Welcome back to the Weight Loss Decoded podcast, GLP edition. I am your host, Sharon Polsky, the GLP Fact Fairy. And on today's episode, we are going to talk all things lifestyle intervention with Dr. Ben Gonzalez. And he's actually a lifestyle intervention specialist. And then once he gets people's lifestyle balanced, then he introduces GLPs. So it's a little bit different approach. I think a lot of physicians use GLPs, and then as you struggle, they go, aha, maybe we should go look at their lifestyle. He approaches it just the opposite. He's also one of the keynote speakers for A4M functional medicine conferences. So he is a wealth of information. So I'm really looking forward to a conversation with Dr. Ben Gonzalez. So I am so excited to introduce Dr. Ben Gonzalez, and I met him at the A4M weight management certification course. He was one of the speakers there, and I really loved what he was saying about how GLP-1s aren't just like this quick fix, and that we really need to talk about lifestyle intervention and really just use GLP-1s as an opportunity to teach our clients lifestyle intervention. And so that's what we're going to talk about today. So Dr. Gonzalez, tell us a little bit about what you do, and we'll get started with our conversation.
Hi. Well, I've been doing, first of all, been in medicine for over 30 years. And I started out in trauma and emergency medicine. I was in the military at Walter Reed Army Medical Center. Retired, I can't believe I'm saying this, almost 20 years ago. But I started out in medicine under the auspices of Dr. Andrew Weil at the University of Arizona. That's where I did medical school, with the influence of Dr. Weil and nutrition. Even before then, I was into medical nutrition because of sports medicine and into genetics as well. So my master's work was in genetics. So all that just honestly led to an integrative approach to medicine, even in the emergency room and in trauma. So retired from that 20 years ago. I was seeing patients coming into the emergency room over and over and over with the same issues, despite seeing them and taking care of them and sending into the system, fixing things like the uncontrollable diabetes, the issues with the comorbid issues with diabetes, and I just kept seeing these patients come back over and over. And I decided to change directions. So I opened up my clinic 20 years ago with the focus on integrative medicine through food as nutrition, right? And food as medicine. And so I've been doing that for 20 years. My passion for women's health comes from the fact of how my sisters, my mom, my wife, all the female patients I've taken care of in the past, how I noticed that we were telling them the same thing we were telling men, to telling a man or telling a woman the same thing we tell a man about how to lose weight or how to fix their medical problems, when their physiologies are different.
Oh, and it just doesn't work. I mean, I've told you,
Right.
my mom looked at the Reader's Digest diet of the week her entire life and was overweight until the day she passed away. And it burdened her to be overweight. And everybody just kept telling her, eat less, eat less. My mother could not have eaten any less, and she gained weight every single day. So that narrative is so prolific in the fitness industry, the medical industry, everywhere. And it's false. And it's massively false, especially for women.
30 years ago, the narrative for food is nutrition and food is medicine, and we need to take care of the health of the country through food is the exact same as it is now, with the country being in the worst place. When I started medicine, the obesity rate was about 11%, 12% when I first started medicine. Now, obviously, it's 40%, with the idea in about another 5-6 years, the obesity, not overweight, obesity rate of this country is going to be 50%. Now, that's not...
And we're not even talking about childhood obesity, which is a whole other issue.
Discussion, right? Yeah. And
30 years ago, what was the childhood obesity rate? Very, very low. Now it's very high.
Now The extreme obesity rate is 10%. Think about that. So it was 10% when I started medicine, just the obesity rate. Now, extreme obesity rate at this as of a couple of years ago is 10, 11%. So that is a scary statistic, especially when you look at kids, childhood obesity, and the whole thing. And then you were talking about mom. Well, yeah, that's one of the passions is my mom. She was morbidly obese for most of her adult life, going through all the different things that the doctors tortured her with the different diets. And then the Reader Digest approach with eat hot dogs all day long, you'll lose weight, that pseudo ketogenic approach, 20 years ago.
Oh, my mom did it too. My mom had logs of cheese,
All of the
bacon,
cheese
and hot dogs in her fridge. And I was like, leading cause of colon cancer is processed meat. What are we doing here?
Who have passed away from their obesity issues. My wife, who's in phenomenal shape, has been all her life a vegetarian, had her first heart attack at the age of 38 while she was at work in the salon doing hair, having a heart attack, despite having three specialists who are taking, three medical specialists who are taking care of her for her lung issues, her gut issues, her GYN issues, when all of that was related to one issue, and that was her cardiac disease. But she's a woman, and so we treated her like a man. She had all these different, and then after her heart attack, ended up with 4 specialists, right? A cardiologist. And just the whole journey that women go through in this healthcare system is just biased. It's totally biased. So
well, it's very hard to even find a GP that knows anything about hormones. And then you can't find a gynecologist. Gynecologists are trained to make babies and deliver babies when the majority of the female population doesn't want to have babies or are past the age to have babies. But we have no way to treat them because nobody knows anything about hormones. It's crazy.
The 3 doctors, the 3 specialists that really need to understand how to optimize, the endocrinologist, the GYN, and the general practitioner, right, the internal medicine doctor. And I'm defending my colleagues here. It's not their fault.
No, it isn't.
I want you to understand, whoever's listening, do not be mad at your GYN doctor for not understanding hormones from the optimum side of things, for telling the 25-year-old the same thing they're telling their postmenopausal women how to lose weight. Don't blame them because the system beats it into us as physicians to follow certain tracks of what's called gold standards based on old biased literature. It's beat into us to follow this because if we don't, we get in trouble from our boards or from we just get in trouble if we don't. And so it's beat into these 4 specialists. And to leave that system is a difficult thing to do. And that's what I did 20 years ago. And that kind of leads to who I am now today. It was difficult and it's not easy to leave the system. But I practice independently in a solo practice in Maryland, Atlantis Medical Wellness Center. And I'm independent of all insurance companies.
That was going to be the next thing I was going to say. And so much of this is dictated by insurance. And people laugh at me that I spend for a single visit with my hormone optimization doctor, $450 a visit. And they say, but couldn't you go to an endocrinologist, a gynecologist, and your GP and do this? No, I couldn't do the same thing because the system isn't designed to do that.
And when I met my wife, it was 4 years after her heart attack. I didn't know her at the time. She had the heart attack. It was 4 years after her heart attack. She had all these specialists, and I kind of liked her when I met her, just a little bit.
Just a little bit.
And so I put her through my metabolic repair approach, and she was on 4 different cardiac drugs. She was having the side effects associated with those drugs, but it was helping her heart. Don't get me wrong, it was still helping her heart. Her ejection fraction, or the amount of blood that's pumped out of the heart, the percentage, was around 33% at the time when I met her. It was 29, 30 when she had the heart attack. So with the drugs, to make a long story short, put her through my metabolic approach from the gender specific who she was at that time as a woman, And this is not a story about getting her off drugs. It's a story about redirecting who she is as a woman with her condition and putting her on the right medications that were specific to her. And yes, she got off all her cardiac medications. She was on the right medications and supplements and diet. Remember, she's a vegetarian, and she still is, but her protein was an issue at the time. So fixing her diet along with all the other things that were needed, to include her vitamin D level was like 11. Her testosterone at the time was 0. Does anyone in this audience, if you don't understand, testosterone is a powerful hormone in a woman that doesn't just affect libido.
Well, it's so crazy because testosterone is a dominant hormone in women, and we don't even talk about it.
Health, heart, strength hormone, along with brain focus and clarity and muscle and recovery and all the other things that testosterone plays a role in. So she got on all these, and her ejection fraction without the cardiac drugs at her last cardiac catheter was 45%, which is a remarkable improvement on the right medications. And here's the funny part of that story. After, when she did her last cardiac cath in the hospital, all the cardiology fellows were saying, see, the medications worked, because on the electronic medical record, it showed that she was still on her cardiac medications, even though she wasn't for over about 18 months. And, oh, see, the medications are working. And I was sitting in the back with all the cardiology fellows rounding around her, just listening to this. And she said, I haven't been on these medications in over a year. And they're like, oh, well, no, that's not right. And she goes, no, I'm on this, that, and the other. And sure enough, in that chart where she documented when she, in the intake, showed that what medications and supplements she was on, the cardiology the cardiology fellow attending was sitting in the back with me, and we were listening to the fellows. And they were saying, well, the medications got you into the right place. That's why your heart is. They were still debating. And
oh, I see it all the time. Yeah.
Telling it to her face that what you're on now isn't what got you better. It was the medications that you were on 18 months ago that you'd stopped. They were still fighting. Now, here's what my point on this is: we are in medicine so narrow-minded, so folks, so beat into us that this has to work because the gold standard is this, that we don't have our minds open to the fact that, yes, you need to look at the individual, at the woman especially, from a functional, integrative approach, that it's not just about the heart, it's not just about the lungs, it's not just about the gut, it's about you as a whole person, as a woman, that you need to manage.
And what I try to do with my clients is I really try to simplify all of that. And I always say, let's start with the 5 factors, which are sleep, stress management, hydration, nutrition, and movement or exercise. I can't even call it exercise. Half these people are so sedentary, I got to just get out of the chair and walking. So I always say movement.
Add a 6th one, breathing.
Breathing. Yes.
They do not know how to breathe.
They do not know how to breathe. That is actually a great one. I'm going to add it. So when I really focus on that with people, 9 times out of 10, they're only doing one of those things. Their sleep quality and quantity is terrible. And it isn't because of menopause. Yes, a lot of my clients are perimenopausal, menopausal women, but they've never had good quality or quantity sleep because they were told from the time that they were small children, sleep when you die. You'll sleep when you die. You can't be successful unless you sleep. And so I'm like trying to re-engineer a conversation about sleep that these people have had like knocked into their heads since they were 5 years old. And so the sleep and then stress, I'm not telling people to avoid stress. We can't avoid stress, but we have to learn to mitigate it and manage it. So those are probably the 2 biggest ones that I run into. And people on GLP-1s don't fix these 2 things, and the GLP-1s don't work. And so it's really fascinating to have the lifestyle intervention conversation, because we've got to go back to the lifestyle regardless of whatever medications they're taking, including 100%. Their heart medications for your wife or anything like that.
100%. So that's who I am. This is where I come from. This is why I'm passionate about it, especially from the women's health perspective. And this is why I consider myself a medical feminist, because all this approach, the entire approach for health care, should be focused on the individual, who they are as an individual.
How did you fall into the GLP-1s? Did a patient come to you and say, hey, I want to try this? Or did you, like a colleague say, have you heard of it? Or how did you fall in? Because they've been around for 15 years, a lot longer than they became mainstream.
So this is why I lecture on the subject, because I've been utilizing these GLP-1s for over 8-9 years almost. And they came from, I actually introduced the GLP-1s at A4M in 2017 at the Boston weight loss seminar, or not seminar, but the whole, it was a full day program, and the weight loss was my programs for the weight loss seminar for A4M. And I introduced it in 2017. I'd been using them before then mostly for my diabetics, but we noticed the weight loss effect, of course, and then we started using it for our weight loss. And yes, I utilized HCG for weight loss as well, from the appropriate HCG perspective. And so at that time, I was using both HCG and the GLP-1s for weight loss and diabetes control. Now, remember, this is not about weight loss. I want to mention something here. This is really important. This is like critical to everything that has to be talking to that's about weight loss and diabetes and obesity. I don't care. The first thing we tell about our patients is, I do not care about your weight. I don't care. Yes, I know it says weight loss center on my label. Yes, I know I'm the weight loss doctor and weight loss expert. I despise that term. We've never liked that term. In the years I've been doing this, we do not like the term weight loss. What we do is metabolic repair. So it's all about metabolic repair, and weight loss is just a side effect of that metabolic repair. Because if you're managing metabolism, weight loss becomes a positive side effect, and it allows for the sustainability of that weight loss that you've had. In the medical literature, there's a profound amount of, a huge number of studies on weight loss, huge amount. There's a very small percentage of studies that look at the sustainability of that weight loss, of how to sustain that weight loss. The general idea since I started medicine 30 years ago is, lifestyle changes, food is medicine. Yeah, it's the same. Yes, the narrative is there, but the actual action on understanding what metabolic repair is not there in the system.
Yeah.
And so I want to make that really clear. We're not talking about weight loss. So when I was utilizing the GLP-1s 8-9 years ago, we noticed that people were improving, and we solved a little bit of side effects, and we corrected those side effects very easily and very quickly.
It is very easy.
Yeah, and focus, and if you understand metabolic repair, then you understand it's not about the drug, because you guys all in the audience, some of your older patients in the audience, people in the audience, remember fen-phen? It worked great. It's a fantastic weight loss drug. It worked phenomenal for 4 years, all the way
until you have a heart attack.
Until a point where you killed all those women or hurt all their hearts because of the valvular issues that they were having, including my mother, who had 2 open heart surgeries directly related to fen-phen that she was on. Yeah. So having said that, it's not about weight loss. The drugs are to help an adjunct in moving that body into a better place for metabolic repair, and all those other things that have to be sustained, that have to be addressed with the weight loss and with the metabolic repair needs to be addressed, including micronutrient issues, macronutrient issues, hormone issues. What's the point of doing exercise? What's the point of exercising more and eating less, that same old narrative over years,
over and over,
if you don't have the tools in your body to sustain that? And we see this every single year on January 1st through March 1st. Yep. We see that person come to the gym, they're working really hard, you see them sweating, you see that 55-year-old woman with the center, that man with the big belly but the great legs in the gym doing their thing, and they look the same. They may have lost 5-10 pounds. They're so happy, and then they stop exercising. What happens? Back to the same body, because the underlying tools in their body, the underlying metabolic issues are not fixed.
Correct. And I think that there are indirect, well, I know that there are indirect benefits and direct benefits of GLP-1s. The indirect benefits of GLP-1s is crowds out the food noise, and it gives us an opportunity to make those long-term lifestyle changes. And so that's one of the things I love about GLP-1s are the indirect benefits. But the direct benefits of GLP-1s are even better. Way more clarity, way better brain function. I have seen massive improvements in gut health from people on GLP-1s. I know there's this misinformation campaign about how it causes stomach paralysis and nausea and vomiting and diarrhea. I've had one client out of all my clients have severe nausea, and it was a lot of lifestyle issues. Like she was still drinking alcohol and taking GLP-1s and things like that. But I've seen massive gut repair from it. So talk a little bit about those indirect and direct effects of your GLP-1s.
My favorite, direct and indirect. So it's the same category. So here's a good question it's a profound question with a profound answer. The profound question is, what is the number one cause of all chronic disease, non-infectious chronic disease issues? The number one cause, the number one direct cause of all chronic non-infectious disease processes is insulin resistance, diabetes. So my favorite side effect of the GLP-1s is that direct and indirect management of insulin resistance, the number one cause of all chronic non-infectious disease processes. So that's my favorite. I mean, if I stop the conversation right there, we're done. Now, of course, how to utilize the GLP-1s as an adjunct rather than as the main reason for weight loss and all those other things need to occur. But if we utilize this tool, this wonderful tool called GLP-1 agonists and all the different types that are there, the monos, the bis, and the tris, if we utilize that from that perspective, then you have fixed the obesity issues and the escalating chronic issues in this chronic comorbid issues in this country. You're fixing it, not improve. You're fixing those issues.
And we've really fixed women's health. I mean, this takes you right into women's health. PCOS, perimenopause, menopause, and the insulin resistance is the through conversation in all of these from the age that these women are 12 to 80.
I'm going to digress a little bit here because this matters, and it's part of what the GLP-1s, one of the indirect effects of GLP-1s. So what's going on with what's the issue with men and women these days that it's a popular issue is hormones, right? We're talking about hormones.
There's a men's hormone clinic on every corner in almost every city now,
right? There's these, every corner has a GLP-1 clinic, a weight loss clinic, and a hormone clinic, right?
Yep.
So, and I get patients coming into my clinics all the time, men and women, mostly men for testosterone. Oh, Dr. Gonzalez, I'm on testosterone and I feel horrible. I feel worse. All my symptoms came back. This is an important concept of an indirect benefit of the GLP-1 agonist, and that is, we in medicine, physicians, coaches alike, tend to forget something really important when it comes to hormones. We talk about hormone levels. Oh, your testosterone's really low, so we got to fix the testosterone. Oh, your estrogen, your postmenopausal, your hormones are really low. We got to fix it. We got to dump all these hormones in you, which is, we need to help with the hormones, but starting incrementally, but not dump all these hormones in just to fix a symptom. We need to think of it of a different perspective. I'm digressing. Go back to the GLP-1. There are two aspects to hormones. It's the hormone itself, the level, yes. But what's the other aspect of the hormone? It's the dang receptor.
Yeah.
If you're dumping hormone into somebody that needs it, their hormones are low.
Yeah.
But the receptor is not healthy to accept that hormone, to do that hormone's job, what's the point of dumping hormone in somebody whose insulin resistance, and insulin resistance directly affects that hormone receptor? So I get guys coming into my clinic with testosterone levels above 2,000. They're on pellets, they're on shots, they're on creams, they're on all these different things. Dr. Gonzalez, my symptoms came back. I felt better, but I was escalating on the testosterone because my doctor, my endocrinologist kept giving me more, or my regular doctor or my hormone specialist doctor came in and gave me more testosterone. I still feel bad. Why, Dr. Gonzalez? And the guy comes in with insulin resistance, diabetes, insulin resistance that's not recognized, and that hormone, zinc problems, vitamin D problems, iron problems, everything that receptor needs to be effective, that receptor is closed, and that testosterone is just bouncing
off. Yeah.
And it's not doing any good, yet they want more. And then when I say, you should see the fear in these men's eyes, when I say, we're going to cut down your testosterone. I mean, all of a sudden they just fall apart like, oh my God, I need more. I'm getting worse. We're going to cut
Remember,
down.
I came from the bodybuilding industry. And so I've got all these men that I'm sending to doctors like you. And the very first thing, they're like, you've been using all this black market stuff. I got to take you off all of that and get you clean for 2 months before we can even do HRT. And those guys lose their mind. They don't, 90% of them won't even do it. They won't even do it.
For that postmenopausal woman, when you say, look, I'm going to start you on some hormones. And then the moment you say that, it's like, oh my God, because they're so used to the there are two narratives that occur, or three actually, that occur that provide fear in women with hormones. The number one is, of course, the old cancer narrative.
Probably the biggest disservice we did in women's health. Number one biggest disservice we did in women's health, because too many women are afraid of HRT, and it is, so you're going to suffer instead?
100%. And then, oh, by the way, you want a quick trick about 30 seconds about how to get someone over that? It's really easy. This is a beautiful narrative. It was just accidental. Came up with about 10, 15 years ago, that you can just kind of start easing the mind of that individual, at least begin cognitive dissonance in that individual who's, cancer with hormones. One time, about 15 years ago, this woman was just totally fearful of hormones, and she needed them pretty badly to take care of her metabolic issues. And she was worried about cancer. And two of my young female staff walked into the room, and I looked at them and I said, see these two women here? They're 22, 23 years old. Their levels of hormones are high.
Really high, yeah.
They cycle beautifully. They're in great health. And their hormones are super high. Why are they not riddled with cancer? And the reason why is because of that. They're in a better balance of the ratios of their hormones are in the right place. Number one. Number two, it's all their natural hormones, their bioidentical hormones in their body are balanced. They're in the right place. Yeah. They're not riddled with cancer. My job to you, patient who's fearful of the cancer, my job is to balance your hormones to actually prevent disease, to include cancer. And the moment I say some of these hormones and putting in the right balance will help prevent cancer, including hormones like progesterone, will help prevent breast cancer directly. Then it starts to either ease the mind of that individual or at least begin the cognitive dissonance and allow them to shift their confirmation bias that they look for hormones cause cancer into the realm of open-minded view of what hormones actually do for you in your body.
But the problem is Google. So everybody goes and they Google, what are the negative side effects of HRT? The other thing they do is they Google, what are the negative side effects of GLP-1s? And so then Google is a silo of your fears and your apprehensions, and AI is even worse. So AI actually learns your fears and your biases and spits them at you. And Google is doing the same thing. And so it does bring us back to GLP-1s, because we're seeing the same thing with GLP-1s, where I have clients that could be be hugely benefited, but they're doing the lifestyle intervention. They've worked on their sleep. They read Why We Sleep by Matthew Walker. They wholeheartedly understand why they need to sleep. Great. And then they've worked on their stress management. Their nutrition is almost perfect. And by the way, you shouldn't have to live with almost perfect nutrition. That is one thing I love about GLP-1s, because those people that have suffered for the last 10 years living on perfect nutrition and not allowed a cheat meal or anything else because they'll gain weight, GLP-1s are great for. They're doing their exercise. They're doing their 3 liters of water a day. Great. GLP-1s are such a great tool in that lifestyle intervention toolbox to take them to where they deserve to be because of all the hard work that they really have put in that didn't work.
Dr. Google is a double-edged sword. And I actually encourage patients to bring whatever information, because it gives me the opportunity to clarify.
Teachable moments. I call them teachable moments. You have to have teachable moments with your patients.
Absolutely. And then I tell them this, and this is how I step on Dr. Google in a nice way, without shutting someone down and saying, oh, Dr. Google's an idiot. This is the best way to shut down Dr. Google, saying, look, does Dr. Google know who you are? And is this information directed directly to you as patient Jane, 55 years old, or patient Joe, 22 years old? Are they talking to you, or are they just giving general information and mostly based on the fears that people are looking for? And that starts the Dr. Google.
It makes them think. Yeah, it makes the patient think.
Same with Dr. Oprah, all the doctors, the narrative on the internet. I just put it in perspective for the patient. Say, look, this is why I exist, and this is why you're paying me directly. Is that my job is to look at you as an individual, and then to apply all this great information and apply it to you as an individual. Now, with the GLP-1s, there's on the internet, this is probably the most Googled, I probably get more questions about GLP-1s on a daily basis than I have about any other drug I have my entire career.
I do too.
As a physician. And we need to be careful about how GLP-1s are looked at. They are not the answer for weight loss. They are the answer as an adjunct. They are a safer adjunct for metabolic repair.
Yes.
And you can find GLP-1s on Groupon. And now shops like the Vitamin Shop, I don't know if I can say this in your podcast, probably can, but like the Vitamin Shop is now selling GLP-1s. I don't know if you knew that or not, but
yeah. So they're all doing these affiliate programs. They're affiliating with a telemedicine company. And I work for a telemedicine company who's phenomenal. You get a coach who's me, you get doctors, there's some phenomenal telemedicine companies. And then there's some telemedicine companies that it's just a numbers game, and they're getting as many GLP-1s into the hands of people as they possibly can.
And they're making a lot of money.
Yes.
And then this is where all the narrative online about the side effects is. You see these people, they're getting dumped. And it's not just the online. I don't want to blame just the online programs. They're doctors.
Actually, I have a bigger issue with the traditional medicine doctors that have a 5-minute appointment with somebody, the person's obese, and they give them the name brand because it is covered by their insurance and gives them no coaching. That's 90% of the people I have that have problems.
The doctors are looking for answers as well as the patient. And that's the trap because of demand. 40% of this country is obese. And they are
also, you probably don't watch TV, but my dad is 91 years old, so I watch TV with him. Every commercial is a name brand commercial for a GLP-1. I mean, every single commercial break. So the patients are walking into their GPs asking for those drugs.
Don't forget the incontinence commercial that I was.
Oh yeah, those two. Yeah, those are the two biggest ones.
So having said that, this is why, and I hope that people that are listening to this understand that our discussion here, we're going to continue talking about this. Our discussion here is not about how GLP-1 is the answer, but first of all, we really should talk about definitions, but I'm pretty sure you probably have definitions already explained prior to this podcast. But GLP-1s are beautiful and safe adjuncts when given out by experts who understand that it's not about weight loss, it's about metabolic repair. And there are a lot of other things.
And it's a tool. We got to keep talking about it being a tool in the toolbox.
You need amino acids, you need micronutrient evaluations, and you need the proper protein intake, and you need the proper hormone evaluation and management. Remember, I'm emphasizing evaluation, because you don't just dump hormones in somebody just because they need it. It's one of the mistakes that we make in menopausal women. By the way, that was the number 2. I told you about the number 1 fear. We regressed a little bit. The number 1 fear is cancer. Number 2 is Dr. Gonzalez. The reason why I'm afraid is because my primary doctor gave me hormones, and I felt really bad, or my hot flashes went away, but then I got bleeding, and I had this and I had that. Well, the reason why is because it wasn't about balance. It was about, if you've been depleted for years from your hormones, and it took years to get down really low, and then in one day we give you a whole bunch of hormone, of course you're going to have issues, because it's like a dry plant. Dry for a long time, half dead, wilted, and you dump a bunch of water in there.
It actually kills it.
Slowly bring it up in a balanced state, slowly bring it up. And it turns out the lower doses of hormones were is the appropriate dose rather than the higher doses that we usually give.
Well, we found that with GLP-1s too, is people weren't losing weight on GLP-1s because we weren't doing lifestyle intervention. And we said, wait. Let's not increase their GLP-1s. Let's keep them down, and then do the lifestyle intervention piece, work on their sleep, their stress management, their hydration, their exercise, their nutrition, and their breathing. And they ended up being super successful on the lower levels of GLP-1s, and then we were able to titrate them off of their GLP-1s. So I agree with you.
Rarely, 8-9 years of using GLP-1s, rarely do we need, in my practice, need to escalate beyond the second tier, and rarely do they need more than 3, 4, 6 months worth of medication. On the GLP-1 Wegovy website, for example, on the Wegovy website, they say, you have to be on it for at least 12 months, and then you need.
Well, that's because the clinical trials, all the weight loss was based on 12 months, and that's what the FDA approved.
But that's not true. That's definitely not true.
Well, because they did no lifestyle intervention, they just gave people the drug. That was their clinical trial for both the name brand drugs.
Yeah.
And it was all based on 12 months. So if you had not one word, but one sentence of advice for people taking GLP-1s and in terms of lifestyle intervention, what would that advice be?
Oh, that's easy. That's easy. It's the very first sentence we begin with all of our patients, is that let's talk about how to sustain what you're going to do. Let's talk in the beginning. You talk about how you're going to sustain the improvements in the weight loss. Not wait till the end and then, okay, let's talk about how we're going to sustain this. You start that narrative. You want to know how you're going to sustain the benefits of what you're doing out of the GLP-1s in the very, very beginning.
So it's part of a program right from the beginning. We don't create the program at the end to titrate you off. We create the program at the beginning, and it's all part of the program. That's my love language that you're speaking right there. It's all part of the program.
Without that discussion, without that at first, like, we got to start the narrative of how to sustain what you're going to improve. And that narrative is different for the 25-year-old, the 45-year-old, the 55-year-old, and the 75-year-old, male and female. It's different. You don't do the same thing for each of those.
100%. I totally agree with you. Dr. Gonzalez, thank you so much for taking the time to speak with us and have conversations about lifestyle intervention and GLP-1s. And maybe we'll get back on and we'll talk about something like GLP-1s and dementia, because I know that's something that's near and dear to my heart and near and dear to yours. So let's book in and let's talk about that in the future. And you are a wealth of knowledge, and I really appreciate you taking the time to speak to me.
Well, thank you so much for inviting me. Appreciate it. Have a good rest of your day.
I want to thank you for tuning in to the Weight Loss Decoded GLP Edition podcast. My name is Sharon Polsky, your GLP Fact Fairy. And if you liked today's episode, if you could please subscribe, like, and share with your friends, that would be great. I also want to remind you that these are just the opinions of myself and my guests and should not be interpreted as medical advice. Until next time, ciao for now.